Hi, welcome to the explanatory walkthrough of the Dementia Assessment Panel. The Dementia Assessment Panel by the Testing Shop offers a comprehensive genomic approach to understanding an individual's predisposition to cognitive decline and dementia-related neurodegeneration. This panel is designed for individuals who want to move beyond generalized risk factors and gain deeper insight into how genetic variants may influence the onset and progression of dementia, often long before clinical symptoms appear.
To generate these insights, the report uses a polygenic risk score algorithm that evaluates the cumulative impact of multiple SNPs to determine genetic predispositions. Each trait is categorized as high, medium, or low risk, supporting clear interpretation and greater clinical confidence. To guide targeted clinical action, the report is organized into 6 key domains that reflect core contributors to cognitive decline: neurodegenerative risk genetics, microbiome cognitive health profile, dementia's metabolic risk indicators, homocysteine regulation, neuroimmune health, and nutrient metabolism profiles.
We begin with the first domain, neurodegenerative risk genetics. This category explores the genetic architecture underlying susceptibility to neurodegenerative processes, with a primary focus on dementia-related pathology. It includes 2 traits: susceptibility to dementia and ApoE risk susceptibility. The susceptibility to dementia trait evaluates genetic variants associated with amyloid beta deposition, tau accumulation, neuroinflammation, and neuronal resilience key mechanisms that contribute to dementia development.
The report includes a curated gene and SNP list displayed on screen, with each marker supported by published research. For patients with high or medium genetic risk, amyloid and tau-related vulnerability may be amplified by metabolic dysfunction. In these cases, providers may consider a low glycemic, antioxidant-rich dietary pattern that supports glucose regulation, lipid balance, and neuroprotection. Nutrients commonly emphasized include omega-3 fatty acids, flavonoids, and polyphenols, alongside consistent aerobic activity and strong sleep hygiene to support long-term cognitive resilience. From a supplementation perspective, clinicians may consider evidence-informed nutrients that support mitochondrial function and synaptic integrity, such as omega-3 fatty acids, Bacopa monnieri, astaxanthin, CoQ10, curcumin, and resveratrol, based on clinical appropriateness and patient history.
Next is APO risk susceptibility. APO plays a central role in lipid transport, neuronal repair, and brain aging, and it is strongly associated with late-onset dementia risk through altered amyloid clearance and neuroinflammatory signaling.
When an individual carries 1 or 2 copies of the epsilon-4 allele, such as epsilon-3/epsilon-4 or epsilon-4/epsilon-4, their genetic susceptibility to cognitive decline is notably higher. Even moderate risk genotypes, such as epsilon-2/epsilon-4, may warrant earlier attention to modifiable risk factors. For individuals with high or moderate genetic risk in either dementia susceptibility or APOE-related pathways, targeted interventions can play a vital role in protecting long-term cognitive health. Nutritional strategies often emphasize low glycemic anti-inflammatory meals that include cold water fatty fish, leafy greens, cruciferous vegetables, berries, and extra virgin olive oil to support lipid metabolism, oxidative balance, and pathways relevant to amyloid clearance. Reducing processed meats, added sugars, and trans fats may further lower neuroinflammatory burden. Lifestyle strategies should prioritize aerobic activity, strength training, and consistent high-quality sleep, each associated with improved neurovascular integrity and reduced cognitive risk burden over time. Daytime light exposure and reduced sedentary behavior further support circadian regulation and cognitive performance.
Next, we move to dementia's metabolic risk indicators, which examines how metabolic health intersects with brain function through insulin signaling and lipid metabolism. Within this domain, the trait dementia's disease metabolic interaction susceptibility assesses the degree of genetic overlap between dementia-related pathways and metabolic traits such as fasting glucose, fasting insulin, and HDL cholesterol.
Genes in this section, including MADD, PICALM, CLU, and GCKR, reflect pathways related to insulin signaling, glucose metabolism, and lipid transport, all of which influence neuronal energy delivery and vascular health. A high or medium genetic risk suggests a stronger inherited tendency toward dysregulated glucose and lipid metabolism, which may accelerate cognitive aging through oxidative stress, impaired neuronal energy utilization, and systemic inflammation. A low-risk result indicates minimal genetic overlap, though maintaining optimal glucose and lipid balance remains essential for long-term brain health in all patients.
For those at increased risk, dietary patterns that reduce glycemic spikes and promote vascular stability are especially important. Consider emphasizing colorful polyphenol-rich fruits such as berries and pomegranate to support vascular integrity and reduce oxidative damage.
Swapping processed condiments and spreads for whole food alternatives like avocado-based options or tahini can improve nutrient density and fat quality. Limiting heavily processed convenience foods, especially high sodium or additive heavy options, may help reduce metabolic and cognitive stress. Lifestyle interventions also play a critical role. Incorporating strength-based training, such as bodyweight movements or kettlebell-based exercises, 2 to 3 times per week can enhance insulin sensitivity and mitochondrial function. Prioritizing sleep hygiene, including reduced screen exposure before bedtime, supports cognitive recovery and hormonal balance.
The next domain is neuroimmune health, which includes the trait chronic inflammation susceptibility. While inflammation is a normal immune response, persistent low-grade inflammation, particularly within the brain, can become damaging over time.
This trait evaluates genetic variants associated with inflammatory signaling, immune regulation, cytokine responses, and tissue repair.
A high or moderate genetic predisposition suggests neuroinflammation may play a more influential role in shaping brain health trajectory, increasing sensitivity to internal or environmental triggers that promote inflammatory activation and elevating long-term cognitive risk.
For high or moderate risk individuals, supporting immune balance becomes a central prevention strategy. Nutritional approaches may include emphasizing fermented foods, beta-glucan-rich grains, and omega-3 sources such as ground flaxseed to support the gut-immune interface. Removing processed meats and sugary beverages and replacing refined starches with fiber-rich options such as quinoa can further reduce inflammatory load. Environmental triggers should also be considered. Water filtration and minimizing exposure to conventional chemical-based cleaning products may reduce immune activation from external sources. In addition, cognitive engagement practices such as language learning, reading, or puzzle solving can support mental stimulation and build cognitive reserve, potentially buffering inflammatory effects on brain structure over time.
Next, we move to the microbiome cognitive health profile, which explores how gastrointestinal function may influence cognitive aging. Within this category, the trait gut-brain resilience evaluates genetic susceptibility to gastrointestinal disturbances linked to dementia risk.
The primary gene assessed is FUT2, which influences mucosal secretions and thereby affects gut microbial composition and immune tolerance, both critical for a stable gut-brain relationship. A high or moderate genetic risk suggests increased susceptibility to gastrointestinal imbalance that may indirectly increase vulnerability to cognitive decline. A low-risk result suggests a more stable gut environment, although proactive gut support remains valuable for healthy aging across all risk tiers. For individuals with increased genetic susceptibility, nutrition plays a central role in strengthening gut-brain communication, including foods such as unsweetened yogurt, ripe bananas, and rolled oats, supports beneficial bacteria such as bifidobacterium, while adding chia seeds and leafy greens like spinach supports microbial diversity and lowers inflammation. Limiting refined grains, deep-fried snacks, and packaged gluten-free products may further protect gut barrier integrity and microbial balance. Lifestyle strategies also matter. Evening breathing practices, such as box breathing, support parasympathetic activation and restorative sleep. Replacing evening alcohol or caffeine with calming herbal teas, like chamomile or lemon balm, may improve circadian alignment and reduce gut stress. Reducing late-night screen exposure and setting consistent unplug time supports nervous system regulation and cognitive recovery.
The next category is homocysteine regulation, with a focus on hyperhomocystinemia susceptibility. Homocysteine is an amino acid produced during methionine metabolism. While it is normally recycled, chronically elevated homocysteine can become neurotoxic and is associated with oxidative stress, inflammation, and vascular damage factors that impair neuronal health and accelerate cognitive decline.
Elevated homocysteine has also been linked with increased amyloid beta accumulation and tau phosphorylation, two hallmark processes in neurodegenerative progression. This trait evaluates variants involved in methylation and homocysteine metabolism. Key genes include MTHFR, MTR, and MTRR, which regulate folate and B12-dependent methylation cycles, along with HNF1A, which influences liver-related clearance pathways. A high or moderate genetic risk suggests greater likelihood of elevated homocysteine over time, particularly when combined with low folate or B vitamin intake, impaired detoxification, metabolic dysfunction, or chronic inflammation. A low-risk result indicates more efficient regulation, though methylation balance remains clinically relevant for cognitive health across all patients.
Finally, the nutrient metabolism profiles domain evaluates how genetics influence processing of essential nutrients linked to brain and systemic health. It focuses on two key traits: vitamin D deficiency susceptibility and zinc metabolism profile. Vitamin D deficiency susceptibility evaluates genetic variants influencing the absorption, conversion, and utilization of vitamin D, a nutrient important for immune regulation and cognitive protection.
Vitamin D supports brain health through mechanisms related to amyloid regulation and neuronal inflammatory balance, and genetic predisposition to deficiency may increase vulnerability to neurodegeneration. Individuals with moderate to high genetic risk may be more prone to low vitamin D levels, which can impair cognitive function over time. Encouraging the inclusion of nutrient-dense foods such as seaweed, mushrooms, and wild-caught fish can help support vitamin D status and deliver additional neuroprotective compounds. Substituting butter or processed fats with extra virgin olive oil or avocado can reduce inflammatory load and support metabolic function. Safe sun exposure several times per week and vitamin D. 3 supplementation may be considered based on clinical review and lab monitoring.
Zinc is essential for brain function and cognitive health and plays a role in oxidative balance, immune defense, and pathways relevant to amyloid beta aggregation. When zinc levels are imbalanced, especially in deficiency states, patients may experience increased risk of memory and cognitive impairment through oxidative stress and protein aggregation mechanisms.
If the report indicates moderate or high genetic risk for zinc deficiency, the genetic profile may impair zinc absorption, metabolism, or retention, increasing vulnerability to neurodegeneration. In these cases, providers may encourage zinc-rich foods and recommend preparation strategies that improve absorption. Cooking methods such as steaming or boiling can reduce phytate effects in certain foods, supporting zinc bioavailability. It is also important to consider that chronic use of antacids or proton pump inhibitors, when not medically necessary, may impair zinc absorption by lowering stomach acid levels. Based on the genetic insights provided in this panel, select supplements and laboratory assessments may be considered to support cognitive health, inflammation balance, metabolic resilience, and gut-brain function. Suggested labs may help evaluate neuroinflammatory markers, metabolic status, nutrient levels, and gut function core areas closely linked to dementia risk.
Overall, the Dementia Assessment Panel provides a comprehensive genetic analysis of contributors to cognitive decline, including neurodegeneration risk, chronic inflammation susceptibility, metabolic dysfunction overlap, gut-brain resilience, homocysteine regulation, and micronutrient metabolism. By identifying an individual's unique genetic susceptibilities, this panel supports healthcare professionals in implementing earlier, more precise strategies to promote cognitive resilience and long-term brain health. Thank you.